So thank you very much, Kathy, and thank you to the Ad Club for giving us this opportunity here today. Brilliant. Thank you. That's a descriptor that I'll try in vain to earn. So Stan Nowak from Aetna. At Aetna, we believe the healthcare system, like Walter Cronkite, is not perfect. We think it's not a healthcare system. It's a sick care system. It stands on the sidelines and waits for you to go out and get hurt or sick, and then it springs into action. Aetna chases that action with payments. And we think fundamentally that has to change. We think we should be investing with you in your health instead of paying for your sickness after you're diagnosed. And that's a massive change. That's a massive change. We have to do that only in partnership with consumers. So consumers, as many of you know, spend at least or are responsible for at least 50% of the healthcare dollars that we spend in this country. They're responsible through their behaviors and their choices for about 50% of the healthcare spent in this country. And we want to partner with consumers over the long term to help them achieve their personal best health. And that requires trust. I'm not going to ask you how many of you consider your health insurer a trusted entity in your life today. I suspect I know the answer. So at Aetna, we're on a long-term mission to achieve that trust. And I'm going to talk to you about the role that marketing plays in that. I mean, what is marketing about other than changing people's minds? We're going to talk about some of the things we're doing at Aetna that are changing people's minds and hopefully changing their lives for the better. So as part of this building of trust with consumers, we realized we really needed to reposition the company. Not only in the market, but we needed to reposition it for ourselves. So I'm going to share with you one of our spots that joined the company sort of when I did. And I think hopefully you'll like this.
Health is having the freedom to do what you want to do with your life every single day. So at Aetna, we promise to keep finding new ways to join you so nothing gets in your way. Because no matter where it is you're going or whatever stage of life you're in, we believe that when it comes to health, you don't join us, we join you.
So we join you. That was turning the model on its head, right? Traditionally, we join a health plan. And by the way, I love this kid. He joined on the same day. I see him rarely in the office. I think his hours are better than mine. But I can't overstate the impact this had on Aetna. This was the first new brand campaign in 10 years. And when the company saw this ad, when we're talking to people about this ad, how they feel about the company they work for, extremely positive. The marketplace, we've also seen an increase in our favorability ratings outside of Aetna. But this was really a call to action and a stake in the ground, right? This was a bold claim that we were making, and we took it very seriously, and we take it very seriously. Now, however, when our members, when you interact with the healthcare system, it looks more like this, right? This is not we join you. This is disjointed. It's disconnected. It's opaque, filled with gatekeepers. It's unpredictable. There are surprises. So this is not we join you. And we realized that we needed to really take a different look at how we were going to help this system become a we join you experience for our members over the long term. So David Edelman, who's our Chief Marketing Officer and really a visionary in the space, joined about a year and a half ago, and he decided to set up something called the Office of the Consumer. He hired me to lead that office. But he thinks very broadly about what marketing is and what it can do. And I joined the business. Now, my background was not, I don't think of myself as a marketer. I'm an operator. I had founded a company in the business in the healthcare technology business. We were influencing member behaviors on behalf of health plans. I ran that company for 15 years, sold it, and then joined Aetna. So I didn't think of myself as a marketer, but the problem he was setting out to solve was he would point to the ad and say, we need to live that brand. This was a different way of thinking about what marketers do and what they need to do, and it was a massive transformation. It's a 160-year-old company with 50,000 employees. This was a big opportunity. I was extremely excited about his vision and what we had the opportunity to do and what we were really investing to do at Aetna. But we had to figure out where to start. And asserting a position of trust with the consumer is something we couldn't jump into, right? That's not something you can immediately just achieve or claim. You need to earn it. You need to earn it over time. So we knew that part of earning that, while we want to partner with you in your health, we first got to get right when you need us most. So we looked at where we work with our consumers around their healthcare journey and when they're diagnosed and when they're sick. So we went to the data first, and this graph represents the incidence of the condition in our population. How much we spend on that annually, that's something that we obviously know. We were also able to correlate these conditions to our member satisfaction. So the color coding is relating to how these conditions correlate to member satisfaction or lack of satisfaction. So based on, and then we had to overlay this with what other programs are going on targeting these particular diseases or these categories of illness. We also had to think about, can we make a difference, right? In this category, can we make a difference for patients? And based on this analysis, in part, and other factors, we determined that we were going to focus on the 15,000 patients every year who are newly diagnosed with breast cancer. We thought we could make a difference. It was impacting a significant number of our members every year. We knew we could do better. And so we decided to focus in that area. And we had done a lot of work in that area. So I'm going to share with you one of the artifacts from that work, which was fascinating to me. But we started, like we should, by interviewing everyone in Aetna who touches breast cancer today. Right? We have oncologists, we have senior clinical leadership, we have thousands of nurses that are helping breast cancer patients manage their disease right now, every day. We have employees who are breast cancer survivors. We have experts, we have specialists who are in our organization, and people have worked on this issue before. So we spoke to everyone, we interviewed everyone, and then we looked outside the company. And we interviewed caregivers, families, we interviewed oncologists, we interviewed cancer specialists, and we interviewed family members, and of course we interviewed patients, lots of patients. And so together, that information helped us populate a story. And then we looked at the data as well, and I'll share with you some of what that all told us. And when we did that and then reduced it to a journey map, what you see here is a very nonlinear journey, all right? This isn't buying a car. Every journey's different. It's a very complex journey populated by very difficult decisions. Decisions not only related to your treatment, of course, but related to your choice of diagnostics, related to how you're going to handle work, how you're going to handle family. And we learned things about this journey that we didn't know. We learned about points in the journey where there were opportunities to make the journey smoother, better, to provide better support. And of course, I think it goes without saying, as you're looking at this, this was not about their experience with us. Little red dots, I think that's red, I'm colorblind. But whatever, I think it's pink or red. Those were their interactions with us. Most of these interactions were interactions with their providers, their family, their work, communities. And we learned a tremendous amount. And unfortunately, there are loopbacks in the journey as well. This was sort of the output of a tremendous amount of work that we did and data that we collected and interviews that we conducted. Incredibly important work. And we learned that in parts of it, like in the surveillance period, there's a high risk of depression. Patients who've gone through therapy and are now waiting. So this is traditional marketing work, but we were applying it really in a different way. And we were learning a lot about this very complex journey. And as we were doing it, we were identifying opportunities where we could do better as a company. And clearly, there's opportunity to improve across the journey here. And one of the things that we heard from a breast cancer patient was, I've had cancer once, you've had it 10,000 times. What do you know that I don't know? Right? So we were looking in the data to figure out what we knew that she didn't know. And there was a lot. There were patterns in the data that we were spotting. So we know this is an intense and an emotional journey. And as this team grew, we were coming up with ideas. Now, at this point, we had a name for this project. It is called Project Inspire. I had hired a brilliant young woman, Liz Horgan, who I think is in the room here somewhere. Liz? Oh, there she is right there. To lead this program. While young, she had a couple of decades of experience in health management and was able to really help us harness the resources across the organization to bring clinical experts together with operators, with our nurses, with our program offices to make these things happen. So we had a name. We had started collecting the ideas. What could we do to fix this? And what could we do now? Right? We wanted to do it in 2018. We wanted to start affecting lives right now. And we had a long list. And I'm going to share a couple of those ideas and where they came from now. So what Tori's talking about here was a recurring theme. This is a very complex condition. It has many, many different decision points. There are many different therapies and diagnostic tests that need to be taken, and there are many choices along the way. She was looking for an advocate, someone who could help her not only with her diagnostic issues and her clinical choices, but her life choices. How she could access resources, not in the medical community, that would benefit her. And then how could she manage the administration of a complex disease like this, where there are dozens of providers that you're working with. So clearly we saw opportunity there, right? Could we create I use the word pod of nurses, and I think that's probably not appropriate. A group of breast health specialists that both support, that live, eat, and breathe. They only support breast cancer patients, so they understand the clinical experience, the life experience, the choices that are being made, the resources that are available, paired with an administrative specialist that can help resolve the administrative issues. So if we could have these resources back to back and dedicated to this patient population at the right level so they could support the 15,000 newly diagnosed patients, that could potentially offer a real solution here. Secondly, Amy's talking about something that's kind of odd, especially as you sit in the Google building, right? Information is everywhere, all the time, always on, it's always in your pocket. But what we found was that it wasn't the right information. It wasn't personal information. It wasn't related to your particular brand of this disease. It wasn't related to your stage. It wasn't efficient for you to get at the right information to help you make the choices that were right in front of you. So, and you know, I mean, those of you who've lived life a little bit, you have friends you have that informed patient friend, right? They do all the research. They have a friend who's a doctor at the MGH. When they're making decisions, they're confident in their decision. The world isn't like that. The world isn't that lucky. So, but you know the difference between an informed patient is someone who can anticipate what's happening next. They can manage the issues. They are confident in the decisions that they make because they know what factors go into those decisions. They have the resources they need to guide their path. And compared to the other patient, and we also know this person, who they're overwhelmed by the choices in front of them. They're confused, they're surprised, they have a high risk of making wrong decisions or not making decisions that they should be making. And the difference in healthcare is outcomes, right? People who make the wrong decisions in these kinds of conditions can have a worse outcome. So again, as a marketer, this is a traditional marketing thing, right? We had disconnected, scattered information, and we determined that perhaps if we could curate this information, organize it in a way, not generate the information. We're not going to generate the information. We're curating the information from third parties. If we could organize it in a way that made it efficient for members to find information related to their disease, their stage, the questions and the decisions that they were about to make in a very efficient way, that would help our members and would also help our care managers, our nurses who are on the phone with these folks and had been picking from various points and providing, guidance to members by sending them URLs and emails. But if we could organize it in a way that was much more efficient and much better, that represented an opportunity that would meet Amy's need here. Now, Nolly's trying on a wig. So most of you don't know that a wig is also called a cranial prosthetic. It's considered durable medical equipment. You probably would never guess that a wig seller is in a health insurance company's network. So this is but I think even though we haven't experienced it, hopefully, you can appreciate that this is a identity-defining moment. So, and what we found was that some of our policies were making this more difficult. So part of Project Inspire's pile became not doing that. Now, we didn't get to recommend changes. We had to make the changes happen. And I'll tell you that this is a 50,000 person organization. It feels like 49,000 of them can say no to change. This slide does a poor job of explaining the complexity of implementing change to benefits, changes to the way we treat patients across our business. It is exceedingly complex, and there are time scales of getting approvals and making changes. We talk about highly regulated businesses. This is a business that's regulated both at the federal and at the state level. There are state approvals that are required. There are client approvals that are required. So even when even when you get everyone to sit around a table and nod their head that this is the right thing to do, it might only be able to be done next year or the year after filings come in. So I will say change is hard, and I was fortunate. The value of the brand campaign internally was to motivate our employees. I was shocked, honestly shocked. I came from a 300-person company that I was running. When I went to a 50,000-person company, I thought it was going to be a massive challenge to change the culture of the company. But the culture was there. I say, one of my favorite sayings being in the consumer experience space is that the consumer is the unfortunate victim of the unintended consequence of excellent process management. Right? And I say that to a lot of people in healthcare, and everyone sort of nods their heads and chuckles, because this is excellent process management. And when we talk about journey mapping, by the way, that's the purpose, right? Journey mapping, the purpose is to walk in the member's shoes and to really come face to face with where your excellent process management conflicts with their ability to access care or experience their journey. And we found a lot of that, right? We found a lot of that. We had built up great process. Compliance, number 1, 2, and 3 priority in health plans. Cost savings tends to be number 4. We're changing that model, but the processes are still there. And they're there for a reason. They're protecting the company. You go out of business if you're non-compliant, obviously. So when I say change management is hard, and I know many of you have done it, in a company like Aetna, it is genuinely challenging to make big changes. And even when the employee base is highly motivated to get it done. We not only had a brand that was highly motivating, this project, Project Inspire, was highly motivating for people. But still, we had to make choices. And we identified, as I say, we had 50 ideas, and there was a long list of work to be done. But we wanted Project Inspire to have an impact in 2018. So we focused on a handful of these ideas. So what we needed to do was we needed to identify patients with breast cancer early. Not easy for a health plan, right? We have claims data. It comes in 45 days after you've had a claim, and sometimes it doesn't have breast cancer as your primary diagnosis. So we had a couple of other opportunities. We could redefine our analytic algorithms to identify members earlier based on patterns in the data. We were able to do that. The second thing we needed to do was retrain our service operations team around how to understand when a member was asking questions related to a potential breast cancer diagnosis, about scans or about a different type of benefit or some payment for something, and figure out how to identify them at that point and refer them to this new program that we have. We also needed to curate this digital content, create a digital hub that was accessible both by our members and by nurses that could help refer patients to content that was helpful in the decisions that they were making right now. Finally, we needed to, we certainly needed to stand up this group of breast health specialists paired with administrators. That was sort of the absolute necessity for us. So we could manage, so again, we could identify people and we could support them across their journey. And again, not just about clinical decisions, not just about claims payment, but about the process of managing this disease. And finally, we needed to eliminate or change some of our internal processes that were creating friction in the model for our patients and making it more difficult for them to access care. So we chose Project Inspire as the name of this project. And I'll say genuinely I've been inspired by the response. We have folks who've been 30 years in service operations. I mean, these are as crusty comes, right? And these folks are saying, how can they help, right? It's inspired people around the company. This is the company they want to work for. And you may be asking yourself, is this marketing, right? Because this is actually, to me, it doesn't feel a lot like marketing day to day. But the role that we're playing inside the company is very much marketing. We're changing minds inside the company. We're using marketing strategies here, and we're actually using it to affect lives. We are, at Aetna, attracting an incredible talent pool. I'm interviewing these people often. And the consistent message that I hear from them when they come to us, and they're coming from the best companies in the world, tech companies, healthcare companies, they're coming from consultancies, all the names that you recognize. And what's fascinating to me is they say, look, X company, where I'm coming from, is the best place in the world. I had an incredible opportunity there. And I've developed these incredible skills and experiences, and I loved my experience there. But I want to use my dark arts in a place where I can have a bigger impact, right? I don't want to necessarily use it to sell more credit cards, for example. And so that message, at Aetna, when you join Aetna, you have the opportunity to impact 22 million people. Right? Makes a real difference. And that's been incredibly exciting for me because the message is consistent and we're collecting a really interesting group of talent there. So it is marketing. We're proud of what we do at Aetna. I'm going to share with you an ad before I leave that was made before I joined the company, but I think you'll find it appropriate. Oh, sorry.
It's here. The first night your teenage daughter stays out way too late. But after 3 years of specialist cancer care to guide her into remission, you couldn't be happier about it. Aetna, you don't join us, we join you.
Great. And I don't think we have questions, is that right? Okay. Thank you very much.